screening patients for obstructive sleep apnea, you've got to look at what sort of patient you're looking at. They're not always big fat people. They can be thin people. However, as you'll all probably appreciate that you've got a neck size in people that means if you're a larger person, you've got more fat around your neck, and if you've got more fat around your neck, then you've got the larger possibility of that fat causing a collapse of the structures in your neck when your muscles relax at night. It can be as simple as that for obstructive sleep apnea. So sleep apnea is snoring with pauses in breathing. Essentially what happens is as you snore, you always only ever snore when you breathe in. You don't snore when you're breathing out. That causes a vacuum. That vacuum can be in the pharyngeal area at the base of the tongue. If you're lying on your back, you're definitely going to be a candidate for your tongue falling into your throat. I mean, gravity. When that happens, as you're breathing in some individuals, the inspiratory breath can cause a vacuum that basically sticks the tongue to the back of the throat, and over a period of breaths, that vacuum can get larger and larger and larger until the snoring will stop. And when the snoring stops, that's not necessarily a good thing, because that means that patient isn't breathing. Now, when I say they're not breathing in an apnea patient, an obstructive apnea patient, you'll still have diaphragm moving, you'll still have chest moving, you'll still have brain telling you to breathe, in other words, but the air can't get through. So it's, you've got an obstruction stopping the air, and that's what obstructive sleep apnea is really about. And then you'll get what's known as the brain signaling the body to react and move. You'll get a change in position, you'll get a forcing forward of the tongue, you'll get what's called an arousal, which sounds like somebody's sort of waking up, but they're not. They often don't even remember this. They just stir in their sleep, start snoring again, and then slow back down until they stop breathing. This can go on and on and on, and when you look at the graphs that I'm going to show you in a minute, you can see this pattern forming. So you also can get restless sleep, because as you can imagine, if you're never really sleeping very deeply, you're going to get restless sleep. You're going to get other ongoing